I'm coming back. I'm coming to get down. I'm coming.
Attention.
Coming to dance. To dance.
Attention.
We're gonna dance.
Attention. Hello everyone and welcome to this week's edition of Chat Night Africa. Attention. On Chat Night Africa today, you have a mountain of a scholar. You're going to have a Harvard scholar, a heart surgeon of world renown to answer your question. Yes, Professor Nche Abegli Zama. Attention. Chat Night Africa. Production Supervisor Dr. B. Tapsong Famundam. Technical Director Mumbalingwa. Attention. This is Chat Night, the power of Chat Night, live from Washington, D.C., metropolitan area. Studio Director Beatrice Famunen. Attention. This is Chat Night, the power of Chat Night. Production Assistants Emmanuel Ngwayi Ndi, John Tanto, and Lord Benson at Frontier Street, Bamenda. This is Chat Night Africa live from Washington, D.C. metropolitan area. Special assistant to Chat Night Africa, Daniel Eno.
I'm coming back.
And my head of editing department residing in Lagos, Nigeria.
I'm coming to dance.
Roger Fool. This is Chat Night. This is Chat Night Africa live from Washington, D.C. metropolitan area.
We party hard.
Chat Night Africa is compiled and presented by Divine Shamukong.
I'm coming back. I'm coming back. We're gonna get down. We're gonna get down.
Hello, everyone. Once again, welcome to this week's edition of Chat Night Africa. Scripture says, as a man thinketh in his heart, so is he. While that is not medical science, it underscores the importance of your heart in your body. Ladies and gentlemen, you will soon find out that if you ignore your heart condition right where you are watching this broadcast, the next minute, the people around you may be looking for a space in a mortuary. To be forewarned is to be forearmed. Someone is about to weaponize you with what you need to know about cardiovascular complications. Professor Nche Abegli Zama, a Harvard scholar, a leading surgeon in the United States, is our guest today. You are about to be blown away. This is Chat Night Africa, and once again, welcome to the broadcast. As you can see, you will be having an extraordinary time today at Chat Night Africa. Ladies and gentlemen, join me in welcoming world-renowned heart surgeon, Professor Nche Abegli Zama. Thank you, Professor Zama, for accepting to come to Chat Night Africa.
Certainly, the pleasure is mine. Thank you for inviting me.
The hip hip hooray thrice is for my learned big brother, my friend, the friend of Africans, the friend of humanity. Before we get into serious matters, Professor Zama, you were being pushed to accept me address you by your accolades, Doctor, Professor, Harvard Professor, all that, Penn State Professor. Many people who have those degrees, many people so accomplished academically and professionally don't behave like you. What is the secret about Professor Zama? Unfortunately, I'm going to ask you, call you Professor Zama because that's who you are. You earned it. What's the secret about your humility? So infectious. You are so personable. I've heard so much about you. What's your secret, sir? People who are like you are not as humble.
Well, I always remember a story when I was a little kid, and I have no athletic abilities, never really had. But I'd come home after a soccer game and where I'd scored the winning goal. And then I told my mother what I'd done. I thought I'd accomplished something great. And she didn't really pay any attention to me, and she kept, fussing around the house doing stuff. And I kept, I was following her around like a chihuahua, and I'm trying to impress upon her that I had scored the winning goal. And then after what seemed like a lifetime of ignoring me, she turned around and asked me, how did the team do? So it would take several decades for me to learn the importance of what she was trying to imbue within me, that humility, that you're only as good as the people around you. And for you to score that goal, somebody had to set up the play for you. So I always think in terms of a team. And so I'm really no better than the guy next to me.
This again, you just, I started talking to you the other day and you pleasantly embarrassed me because I never met you before. I thought I was going to meet this guy who talks big and then I walk into somebody who is as simple. If somebody didn't know you, they think that you're a janitor somewhere.
Well, I've been called that a few times in the hospital. That's a different story.
That's a different story. And I do understand, Professor Zama, we will be asking to know at the end of the show how you came to this point. Because there are lots of people in Africa, across the world, who watched the Harvard professor of surgery wondering how you got there. It's not anybody who walks into Harvard and teaches heart surgery. It's not for everybody. And so many people are going to be asking the question, but how did you get there? We'll get to that question at the end of the broadcast. We'd like to know a bit about you, sir. Now, today we are talking about heart health. And if I described your heart as the engine of the human body system, would my description be accurate, sir?
To a point, yes. And fundamentally, the heart is a pump. And the body needs oxygen to survive because we humans and many other creatures are called aerobes. So it means our metabolism, the sum total of the events that take place within us to make us who we are, humans and alive. Every one of those trillions of cells within us needs one molecule called oxygen. And so that has to be delivered to the tissues that have those cells so they can continue to function. Your brain needs oxygen, your liver needs oxygen, the kidneys need oxygen. And so that oxygen is carried by a substance called hemoglobin that is in the blood. And what pumps that blood to deliver it to the tissues of the body, to the organs of the body, is the heart. So fundamentally, the heart is just a pump. It's a very efficient pump that pumps about 120,000 times a day and rarely stops to rest.
So when we talk about heart disease, and Professor Zama, to put things into perspective, is heart disease anything anyone should be listening to or worried about? Why should people care about what you have to tell them now?
So it's a very important question. And if I can start off with a few statistics, one of the most common causes of death on earth is cardiovascular disease. It's the most common cause of death in America. And I want to use America as an example because we have a better system for collecting statistics than we do in Africa. And within the United States, there are more people who die of cardiovascular disease each year than all the top 7 causes of death combined. So if you take all the cancers, lung, breast, brain, bone, prostate, cervix, and you lump them together, all the traumas, the car accidents, and all that together, they barely make a dent to the number that would die from cardiovascular disease each year. So it's an extremely common cause of death. Now, if you translocate over to, say, Africa and Asia, where healthcare systems are not as highly developed, and so we do not have mortality data and statistics, it has also been shown that in those environments, oftentimes the final demise is due to cardiovascular disease as well. So it has global importance. And over 40 million people each year die from cardiovascular disease.
That is very, very serious. So what you talk about, when you talk about cardiovascular disease, what specifically are you talking about? Are we talking about just one type of disease or a litany of diseases that could attack or affect your heart?
So there's a myriad of problems that can affect the human heart. Most commonly, problems related to the coronary arteries. Now, the coronary arteries are blood vessels that supply blood to the heart muscle. So you can imagine an organ, and as I stated, that works so hard, beats about 120,000 times a day from the point of your conception to the day you die. Anything that works hard as this organ needs reliable nutrition itself. And that nutrition, which is in the lifeblood, it contains oxygen, minerals, protein, carbohydrates, and whatnot, is delivered to the heart muscle by these tiny little pipes called coronary arteries. And so what can happen is that there can be a buildup of junk or plaque, as we call it, within the lumen of the coronary arteries. And if that obstruction continues to a critical point, blood flow to the region of the heart that depends on a specific coronary artery can become markedly reduced, and it can lead to death of that region of the heart, which is what a heart attack is it's all about. And so that's coronary artery disease. There are many other problems that can involve the heart. For example, the heart valves. When I travel overseas to do heart surgery, oftentimes I'm not operating on coronary artery problems. I'm operating on heart valve problems. God gave us approximately, in most normal hearts, there are 4 valves, and sometimes children are born with abnormal valves, or sometimes adults acquire abnormalities in 1 or more valves from infections or from congenital problems or just old age, degeneration. And when the valve, which is a one-way gate that allows blood to flow from a chamber to the next or to flow out of the heart, if that gate stops to function normally anatomically, it creates problems to the heart and creates problems to the whole body. And so oftentimes that valve will either have to be replaced or repaired. There are also problems that may involve blood vessels, the great vessels around the heart, the main aorta. It can rupture, and you see that a lot in people with a history of high blood pressure or some type of congenital problem relating to connective tissue that predisposes that blood vessel to rupture. It's probably the most serious and most severe emergency in all of medicine, called aortic dissection. And oftentimes too, you can have people with heart problems related to infections. For example, COVID virus. We're finding patients who present with severe inflammation of the heart muscle itself. Now, you can get that with many other viruses, and we do see that something called cardiomyopathies or myocarditis. And this inflammation can usually resolves itself over time, but it can be so serious that you go into severe florid heart failure, and you would need to have a heart transplant as a life-saving measure.
This is Chat Night Africa. I didn't know that, honestly, Doc, that you have to fly overseas to do surgery.
Yes.
And when I get to know all the things you have to do, you are in Harvard, you are in Penn State, you are going overseas, I begin to wonder whether you have any time for yourself.
Yes.
Now, what exposes people to heart disease? Is it what people do or don't do?
Right. So, it's we could probably spend an entire month discussing cardiovascular disease. So I'm going to talk about one of the most common problems with the heart, coronary artery disease, for example. And that's when you have blockages or buildup of cholesterol and other components within the coronary artery, and reduce the flow of blood through these coronary arteries to the heart muscle that needs them around the clock. That blockage itself that occurs in the coronary vessels is referred to as coronary artery disease. And it's one of the most common problems that we encounter in the human heart. Now, so the question becomes, what are the risk factors for coronary artery disease? Basically, there are four major risk factors. Diabetes, there's a greater incidence of it among diabetics. Hypertension, that's high blood pressure. Cigarette smoking, people who smoke extensively, and also patients with high cholesterol, hyperlipidemias, we call them, lipids, high lipid levels. So if you have diabetes, high blood pressure, you smoke cigarettes, and you have high cholesterol, you are at risk for developing blockages in your coronary arteries, referred to as coronary artery disease, that can lead to heart attacks, and that could, in certain individuals, lead to death.
When
now,
you talk,
having
yeah,
said that,
go ahead, sir.
Must continue. Well, about 30 years ago, a study out of Stanford University actually included a couple of other major risk factors. Sedentary lifestyle. So people who are not as physically active and not physically robust. I don't mean you have to be running like Mr. Bolt to Jamaica on a daily basis, but be at least meaningfully, reasonably physically active and functional. Individuals who tend to lead sedentary lifestyles, there's a higher incidence of coronary artery disease, and also obesity is another one. And we're seeing a global epidemic, and we talk about the COVID pandemic. Obesity is very serious. Obesity also is considered a significant risk factor in coronary artery disease.
When you talk about people who live a sedentary lifestyle, break that down, sir. What do you mean?
So we were actually meant to be hunters and gatherers, humans. We weren't meant to sit in front of televisions for hours, or hunker down in front of a laptop or an intelligent phone, or smartphones we call them. We weren't really intended to, our mode of transportation would be automobiles and elevators. I'm not saying we ought to eliminate these. But that's what I'm talking about, the physical activity. So the converse of that is a sedentary lifestyle where you're not as active as you should be relative to your physical health.
Okay, thank you, sir. We have somebody on the line, I think Vivian Goom, calling from Detroit, Michigan. Hello, Vivian.
Hi.
Yes, what's your question? You want to ask Professor Zama a question?
I just dialed in. I'm still listening. I'll ask a question as we go along.
Okay, I'm asking because you called in. Okay, oh, no problem. You can call back later. Thank you. As I told you, we will have a lot of phone calls on this show today, Prof. Again, I want to really thank you for coming to talk to your brothers and sisters across Africa. Does heart disease affect races or gender differently?
Yes.
Why so?
So I'm going to talk about the gender aspect of this. We know that heart disease now affects, or the presentation actually, the symptom presentation differs in many ways between women and men. Men would classically, for those of us who've been in America, who've been overseas and have watched a show that used to be on television called Sanford and Sons, where he would oftentimes, in missing his wife, make a statement about, I'm coming to join you. And he would clutch his chest and say, it's the big one. So the classic presentation for heart attack is a man clutching his chest and, as a result of the pain or sensation that he may be experiencing. So a lot of men present with chest pain or pain down the arm or jaw pain. I remember years ago, I operated on if you've heard about Carl Sagan, who was a very famous astrophysicist who wrote a lot, was professor at Cornell University. So he died, and the new chairman of the department showed up in my office with a diagnosis of coronary disease. Prior to that, he had spent an inordinate amount of time doctor shopping and exhausting the local pharmacy of their supplies of Maalox and Mylanta for heartburn. And so his heartburn was really a presentation of coronary artery disease. And it took a very astute doctor to make that diagnosis and then do a confirmatory test, which was a cardiac catheterization. And subsequently, he was sent and he underwent a quadruple bypass and did exceedingly well after that. And his heartburn was gone. So men generally would present with chest pain, shoulder pain, jaw pain. I've also had somebody who's had their teeth extracted thinking they have dental problems, only to find out that it actually was heart. And sometimes they'll present with shortness of breath, fatigue. Now, women may just present with something as far out as emotional issues. They may present and just, I don't feel myself. I just have this feeling of impending doom. I feel sad. I feel down. I feel depressed. And what do you think people will tell her in the emergency room? They say, well, you're having emotional problems, psychological problems. How's your marriage? How are the children? And another way women will present is gastrointestinal. They have reflux problems, heartburn. It says, I'm having heartburn now I never used to have. That in itself, I always tell people, I says, when you start having new onset heartburn, suspect the heart. Because the heartburn itself, if it's esophageal disease, may not kill you, but a heart attack or impending heart attack possibly could. So women presentations can be different than men. That's a gender difference. As far as racial differences go, and by the way, 75% of the women are dead within 6 months of their first heart attack. If that's not a statistic that should shake people, then I don't know what else to say. So in women, their outcomes from coronary artery disease treatment are worse than men because the diagnosis is made late and the presentation is not traditional. So being hypervigilant about a female presentations can really save lives. Now, when you talk about racial disparities, we really see a lot more coronary disease presenting in Black folks, more severe coronary disease, people of African heritage, for example, and many other minorities. And I think the difference may not be as much genetic as it means access to healthcare. And if you read one of my recent articles that has gone viral about how just racism and discrimination in the healthcare industry, and the other article I wrote about the George Floyd murder, I highlighted an issue that is of importance to explain what is perceived as a racial disparities or differences in diagnosing heart disease. It's because many of us do not have, people of color, the same access to healthcare, to specialty care as people of the Caucasian race do. And so when we do present, we present in the extremes of the pathology, and obviously the outcomes would not be as good. So access really can be a problem, and I don't think it's genetics. Now, having said that, I'm going to backtrack a little bit. A very important risk factor too for coronary artery disease, extremely powerful, is family history. Now, if you pick the wrong parents, you can be screwed sometimes. So if your father or your mother had heart disease at an early age and died, and you start having symptoms, you need to see somebody as soon as possible. I've never had to do heart surgery on anybody in their 40s, 30s, or maybe even 20s who didn't have a family history thereof.
Chat Night Africa, and you are watching this moving encyclopedia, Professor Nche Ablegui Zama. Prof, you say that man or human being isn't designed to live a sedentary lifestyle. Well, we also know that athletes have dropped off their feet while in action. Ordinary people have, sitting among people, just dropped like chicken. Some go to sleep and just don't get up. When this happened, Dr. Zama, we hear they suffered from heart attack, sometimes congestive heart failure. What is the difference? That's part A of my question. What is the difference between heart attack and congestive heart failure? Part B of my question is, how come people who exercise every day, like athletes, football players, soccer players, just one day drop off the pitch, drop off their feet on the football pitch? If I came to you, the first thing you would probably ask me is, Divine, how many times do you exercise? Now, these examples of people who exercise, we know of Samuel Okwaraji collapsing in a match, Cameroon versus Nigeria. We know of Mark Vivian Foe. I was actually watching that match live in Langley Park, Maryland. When Vivian collapsed, his eyes rolled, and that was it. We know of the legendary captain of the Indomitable Lions of Cameroon, Captain Song Bahana, who fortunately didn't die. On the Sunday morning, he's sitting in his house in Bastos, Yaoundé, and just falls off like chicken. I can go on and on and on. These are people, monsters, who exercise morning, afternoon, night. How do you explain that they will just collapse like that and die?
So there's not one cause of cardiac death in every one of these cases that you are presenting. I remember several years ago when I was working at the Cleveland Clinic, we operated on an African athlete. I believe the gentleman was from Nigeria. He was a famous soccer player in a European team, and he was in his early 20s. What he had then was aortic valve disease. So he had contracted rheumatic fever as a child in Nigeria, and that began to destroy his aortic valve, and things came to a head sometime in his late teens or early 20s, and he began to develop severe fatigue with moderate activity, and a diagnostic study led to a diagnosis of aortic valve disease, and he came to us. We replaced his aortic valve, and he went on to continue to play soccer, and he's been doing very well ever since. So that was an aortic valve problem. So there are many problems that can occur with the human heart. Sometimes you don't have a gross pathology. You don't have an obvious. Gross simply means what you can actually see. And you have a normal looking heart, normal-looking structures of the heart, and you can have sudden death. And oftentimes that may be related to the electrical system of your heart. The electricity in your heart can go crazy sometimes and act up. And it may actually stop. The electrical function of your heart may stop. And if it stops, your heart may stop beating. And whatever the cause of that is, there are drugs that can cause it. There's severe, even psychological issues that can cause it. There's medication that can cause it. There are certain types of infections that can cause it. So you can have an extremely healthy athlete who happens to contract, say, a virus or some other parasitic infection that attacks the heart cells and the heart muscle, and which can lead to his or her demise. And then you also, as I stated, you can be very physically active, very physically robust, and still have a genetic predisposition to certain cardiac problems. And it's just a matter of time, and the clock ticks. And if things come to head, you can develop acute heart failure or acute cardiac arrest from that. And if you do not have access to a tertiary care facility where they can intervene, you may not make it. So beyond the structural issues of the heart, there are also some biochemical things that can happen to certain individuals. And again, as I mentioned, something like an aortic dissection. You did talk about athletes. Several years ago when I was in Boston, we had a member of the famous Boston Celtics who collapsed on the court and died. What this gentleman actually had was an enlarged aorta. The aorta is the main artery, huge pipe, about an inch in diameter, that connects your heart to the rest of the body. And in certain people, due to a congenital problem, that aorta can continue to grow even after your entire body is stopped growing. It can continue to enlarge, and to a point where if it's over 5 centimeters, there's a greater chance of that aorta rupturing. And so you may be carrying a time bomb within you. You run marathons, you play soccer, you this, that, and the other. You're very fit, and someday that aorta may just rupture. And if it ruptures acutely, the mortality in America is probably over 80%. And many other places in the world is probably 100%. There are very few survivals.
You are watching Professor Nche Abegli Zama. Prof, I have somebody on the line, Madam Aitangang. She has a question for you. Let's see, we're connecting with her right now. This is Chat Night Africa. Hello, Aita.
Hello.
Yes, Aita, everyone in the world is listening to you now, including the big professor today.
Good afternoon, Dr. Zama.
Good afternoon, Ida. How are you, my sister?
I'm well, doctor. Thank you. I have a question.
Sure.
What has stress got to do with heart disease? If you don't have a history of diabetes, you don't smoke, you don't drink, and your blood pressure was like say 90 or 110/70, and all of a sudden you're getting up to 140/100. Does stress have something to do with it, and what is the disadvantage of that in relation to heart disease?
So
thank you.
We all need stress in our lives. There's actually a range of normal stress. Without stress, you will be dead. And that's why God had an interesting endocrine gland called the adrenal gland within us that produces a hormone that the layperson calls adrenaline, which is actually epinephrine. And what does epinephrine do? It targets many parts of your body, but when we talk about the heart in particular, there are receptors on every heart cell that epinephrine targets, and it can cause your heart to beat faster and more vigorously. So when you're under a stressful circumstance, and for example, if you're being chased by a bunch of wild animals or a thief on the streets of New York or Washington, D.C., your response is to run, to get out of Dodge. It's because the adrenal gland injects a certain amount of adrenaline, within your bloodstream, and it causes your heart to beat faster to supply more blood to your skeletal muscles, so you can do a more effective job running away from whatever the intruder or the invader is. So you need stress, and that's actually part of the spectrum of stress. Now, and the stressor is the event that causes the stress. So in our lives, we have all kinds of stressors, and we have many adaptive mechanisms to deal with them. Now, stress becomes pathological. Pathological means it becomes a problem, a physical problem, when the intensity of the stressor exceeds your capacity to manage it. And so your heart still stays stimulated, stays overly stimulated, becomes overworked, and your entire system is revved up, and the adverse effects on an organ that has to beat 120,000 times a day nonstop, you can imagine, could be extremely traumatic. And so an excess amount of stress, so it's not just the amount of stress, it's the duration of stress. So if you're facing circumstances in life where you're facing an enormous amount of stress for a prolonged period of time, it can actually predispose you to cardiovascular issues.
The follow-up question to that, Doc, is how about relationships issue? You wanted to say something?
Yeah, so an answer to a question about a blood pressure, excessive amounts of stress can actually lead to high blood pressure, hypertension. And why is that? Also, this hormone that I mentioned is just one of a myriad of hormones, and this is not a course in biochemistry, obviously, or physiology, but you can imagine what this hormone does. For me to dash across the street to evade an intruder or something that is threatening, fight or flight, I need a certain amount of adrenaline in my system to pump my heart, to make it work faster and stronger. Also, I need a higher blood pressure to enable me to drive that blood to the tissues, my legs, the muscles in my legs and arms that need it, my vision, my brain, so I can make the right decisions. And so what happens? Chronic stress, as you can see now, resets the threshold of your blood pressure at a higher level. And so if that happens chronically, that becomes your norm. But a very high blood pressure may not be the best thing for you because certain organs begin to hurt. Your kidneys, for example, and your brain, because you may start to develop disease in your carotid arteries as a result. So it's important to manage stress, handle what you can, and try to avoid what you don't. I mean, if I'm driving downtown, what I oftentimes do if I get to an intersection, and even if I got there before the fellow who's at right angles to me, and they have the look of, they want to be the first one to go across the intersection, I step back and I see to them. So I'm just giving that as an example in life. Don't take on more than you really should and more than you can handle. If you continue to try to be the hero, and then there are consequences, cardiac consequences.
Don't try to be the hero. I like that. And that's very true, Doc, because there have been times that I go to a shopping center and I'm trying to pack into a certain space, and somebody comes there showing me a middle finger. And the tendency for the human being is to react, to fight back. But sometimes I ask myself, even if I won the battle, what trophy do I take home? Nothing. Yeah. So like you said, I see it, yeah.
It's a very good point you're bringing on. And I've been asked that question, and I have learned over time to not take on that, because you win oftentimes by doing nothing. And if I go to the shopping center, classically, I park furthest away for several reasons. One, it gives me a chance to walk, and that's exercise.
That's a good one.
Meaningful exercise is cumulative. You don't have to go on a marathon once a week. It's additive. And also, it avoids some of those circumstances, being the guy that has to park right at the door, because, and then you run into certain terrible actors, as you were talking about, who can bring on unnecessary stress in your life.
And follow up to what Ita asked, let's talk about relationship stress, because I know so many people in the United States, in Africa, who are barely, honestly, they are enduring their marriages. They are living in the same home, but like roommates. So stressful. Could that lead to heart attack, heart failure? And again, I would like you please to distinguish, to draw the difference between heart attack and heart failure.
So
could relationships problems, marital problems,
Sure.
bring one to the point that the person develops a heart attack?
So I'm no expert in marriages, and I'll be a terrible marital counselor, and I know where my expertise lies. But yes, and I do understand that if a relationship gets to a point where it becomes a major stressor, that I believe there's not a perfect relationship in the world, and people should be able to communicate and come to the middle ground, or make it win-win. And I think that's always possible. No truth has ever been attained in life without some give and take on either side. Having said that, if there's an enormous amount of stress in any circumstance in our lives, relationships included, that exceeds our abilities to handle it, that can have adverse consequences on our overall health in general, and in particular on your cardiovascular health. And yes.
Doc, a couple of months ago, a former colleague of mine at Cameroon Radio Television spent time at hospital roundabout in Bamenda with friends, just drinking, having fun over bottles of palm wine. And all of a sudden, he dropped. And that was it. If somebody drops like that near you, not Professor Nche, Zama, but you, somebody who knows nothing about medicine, what should that person do? If you're sitting with somebody either in the living room and it happens like it happened to Song Bahanak, the former captain of the Indomitable Lions of Cameroon, what do you do?
So if you witness let's assume it's a cardiac arrest, so sudden death, somebody collapsed, and you go through the ABCs, and you make sure that it's not a problem with the airway, and you make sure that they're breathing, and you make sure that they have a pulse, and you can just put your finger in the neck, if you have access to an artery, maybe in the wrist or so, see if they have a pulse. And if you can't ascertain that, and then I think you need to start CPR on them, chest compressions, and maybe some. Now the challenge with Cameroon is I'm not sure if they've got a 911 you can call like here. So
you probably call and there's no gas in the van.
They may not have cardiovascular capabilities in the local hospital where you can get a little bit more advanced care. But I'm going to tell you, you can't give up on that. I can't tell you. So a few years ago, I was flying overseas, actually. I was flying to China, and somebody had a cardiac arrest on the plane. And it was massive panic. And the announcement went overhead, and I was sleeping in first class, and I ran over to coach, and I saw this gentleman. He was pale as get-go, and I started CPR. He didn't have a pulse. And I worked on him for about 30 minutes. His heart came back, and he lived long enough to, when we got to China, and they got the ambulance, came there and took him to the hospital. And I've subsequently, I think every Christmas, I get letters from his daughter. So I didn't have access to all the fancy stuff and drugs and equipment, this, that, and the other. So an attempt at CPR, when you notice somebody who collapses suddenly, really could save lives. Now, you may not save as many as you would under circumstances as we have in the US, but I believe that if you see somebody collapse in your presence, you need to go through the ABCs of resuscitation and do CPR.
Now, you're talking about CPR. People in the United States and Europe perhaps understand what you're talking about. Somebody in a village in Africa, please break that down. What is CPR?
So basically, most commonly, when people collapse suddenly, it's because the heart has stopped functioning. And so blood cannot be delivered to the brain. Now, the brain needs constant, continuous blood supply. And if If it receives no blood within 5 minutes, there will be permanent brain damage, and that person is considered dead. So you have a window of opportunity as soon as you notice that somebody has collapsed in front of you, and to see if they're breathing, for example. Now, not everybody will know where to feel for a pulse, and you slap them around and maybe on the face and see if they're responsive. If they're not responsive, you really should start chest compressions, compressing their chest, the middle of the chest, to see if you can wake up the heart. And if you wake up the heart, it may be able to wake up the brain, and the patient or the person would likely awaken from the resuscitation. Now, there's certain circumstances as well. So I always have these mini disasters chasing me wherever I go. I've had to do this several times on a flight. Actually, just about a few months ago, before COVID became a real problem, I was flying on Delta Airlines, and same thing. A gentleman in his 20s collapsed, and I went over to assess him. And he barely had a pulse, and they were already doing CPR, and I just looked. He was sweaty, he was thready, and I looked, and he had a necklace, and I looked at the necklace. Well, I asked the flight attendant to bring us a glass of orange juice, and we forced him, poured it down his throat, and within minutes he reawakened. He was diabetic. So I see. Because I'm a doctor, I sort of think, it's a different algorithm in the way I think and look at things. Also, a few years ago, I'm in New York City, I'm in a restaurant, and a lady sitting in front of me all of a sudden starts to look really pale. Now, and then she collapsed on the table. So I ran over and I noticed what she'd been eating, and I did a Heimlich maneuver. And Professor Heimlich was actually one of my teachers. And out, she propelled this huge chunk of steak, and she became reanimated and did very well. So it depends on the inciting agent or the causation. Now, if it was somebody who was just having a drink and collapses, or sitting and having a conversation with friends and family, I think it behooves upon you to do something at least. And I would recommend chest compressions under those circumstances.
Doug, my friend's mother in Yaoundé, a couple of years ago, went to bed. They were chatting in the evening with friends. And like our mother said back home, your mom and my mom would say, please, make when I go sleep. This woman wasn't complaining of anything. She went to bed, slept in the same position, and did not get up in the morning. Died in her sleep. What could have gone wrong? Here is why I'm asking you this question. Two reasons. If you have a heart, that could happen to you. If you go to sleep, well, it could happen. You don't get up in the morning. And people are asking themselves that question now. Right. What could have happened? And was it a situation preventable?
So it's hard to tell oftentimes without a postmortem, without an autopsy. But more often than not, we know it's cardiac, and it could be one of a whole long list of problems. She may have had coronary disease, because not having the diagnostic capabilities in that geography, it poses a significant challenge in at least having some statistical knowledge as to why most people die in that environment. But I would suspect that she may have had a history of cardiovascular disease that she didn't know about. And you can be functional with significant cardiovascular disease. It just takes that event, that final event that occurs. You could actually walk around or run marathons with 75% blockages in your coronary artery. Like I said, it's a time bomb. You never know when it's going to happen, when you clog it off completely 100%, and you start talking about canceling Christmas. You're dead. So, or she could have ruptured an artery. And that's another thing that could have happened to her. She could have collapsed a lung. It may not even be the heart, but the heart and the lungs are in communication with each other. What happens to the lungs affects the heart. So one of the things can happen is you get a complete collapse, a spontaneous pneumothorax. Actually, they can get a cardiac arrest from that. And it may not even be the heart. You've heard of PE, pulmonary embolism, a clot, a blood clot in the lung, choking off the lung, that generally travels from the legs up the main vein into the heart and onto the lungs. If that happens, as we've known, a lot of people have died from that, famous people. And the famous tennis player, I think it was Serena or something, almost died from it. If that happens and she lays down in bed, and she has a massive pulmonary embolism, clot in her lungs, the heart is now pumping against massive resistance. It fails. It can fail, and she can die peacefully in her sleep.
Doctor, you know what my prayer is tonight?
What?
It's not what you think. My prayer, doctor, is if I had to have a heart attack, probably let it be the day I'm visiting you, because then you know what to do. But on a more serious note, Doc,
Yeah.
when you know all this that you know about this engine that's in your chest, do you at times, as a specialist of world renown, do you feel at times fear that, hey, it's like I'm walking on broken bottles? Because and why I ask this question, Doc,
Right.
is ignorance is a bliss. I don't know about this thing, so I don't really have to worry about. Yeah, your answer, sir.
So it's obviously, the heart has a lot of spiritual connotations and not only physical. And so for years before I got into thoracic cardiovascular surgery, I had this respect, but more so fear of the heart and possibility of a heart attack, because just the expression heart attack itself was such a major emotional trigger. But if you've worked in it, I've operated on tens of thousands of hearts, and it's like I'm just really like a car mechanic. I mean, you get comfortable with engines, you know what I mean? And I've gotten comfortable that it doesn't bother me as much, my own heart, but what bothers me, my concern is the heart that are within other people. And also the concern that so many people could have this, but do not have access to the diagnostic capabilities that we talk about and the treatment modalities. There's so many things we can do these days to treat the human heart. So yes, I don't have personal fear for it. My anxiety with it is usually others that may not have access to it. And really, that's what has spurred me over the years to travel overseas and do a lot of free heart surgery in Asia, Africa, and South America.
Did you say free heart surgery?
Yes. So
I've heard about you, Doc, that you're somebody with a very big heart. Believe me.
No.
Listen, before I came to talk to you, and I've been running behind you the last one year to get you on this show, I've heard so much great things about you.
Yeah.
Your philanthropic actions, activities, helping people, doing free heart surgeries. This is monumental give back. Yes, doctor.
Well, so I'm just really riding on the shoulders of many who, without their motivation, I wouldn't be where I am today. And I've had one of the most famous heart surgeons in the world at that time. A couple of the guys were my mentors. I would say I'm the luckiest man in the world that was trained probably about 15 presidents of societies of heart surgeons. And just because of where I trained, and thank God. And Dr. Cosgrove, who was the president of the Cleveland Clinic, was one of my mentors. And Dr. Carpentier at the University of Paris, where I trained, and a couple other guys at Harvard. But point I'm making is these are guys who their focus was not just on the domestic work that they did, it was global. Their perspective was global. And they spent quite a bit of time overseas. Dr. Carpentier is one of the founders of Doctors of the World and Doctors Without Borders. And so when I was at Harvard, my last year actually, a friend of mine who is now a professor at NYU and we were talking about, we're going to graduate, we're going to have access to all the best technology in the world, but 99% of the world does not have access to what we have here. And then we promised ourselves that we would travel the world and do heart surgery for free. And actually, you wouldn't believe the first country that we went to was Cameroon. And many of you may not remember this, but it was in the early mid-90s. we brought a team there, and we did a lot of pediatric heart surgery at the General Hospital. We operated, I believe, about 30-something kids, very successful. And then subsequent to that, we went to Cambodia, Vietnam, and South America. I go to Brazil and Peru. But it brings me gratification. Really, I'm giving back to humanity because I'm here today because somebody helped me to get here. And so I'm just giving back.
You are one amazing human being, sir. And I have to, not because that's the right thing to say on the show and talking to you, but because the facts just speak for themselves, and the facts are screaming. Ladies and gentlemen, you are watching Professor Nche Zama. I'd like you to distinguish between three things, sir. Sure. When somebody dies in their sleep or collapses on a football pitch, or somebody jogging and just collapses, or somebody sitting there, in Africa, usually they attribute these things to voodoo or to some medicine, witchcraft, and things like that. I'd like you to clearly explain what is meant by cardiac arrest, number one. Number two, congestive heart failure and heart attack. What are the differences?
So a cardiac arrest just means that the heart stops beating. And no matter what the cause, we say the etiology, whatever the cause is, if the heart stops beating for whatever reason, the person suffered a cardiac arrest. Congestive heart failure, if something is congested, so if a room is congested, what does it mean? It has many more people in there. If a car is congested, it has too many passengers or many more than it can handle. So a congested heart has too much volume to pump. So it's not pumping as efficiently, probably because the muscle is weak. And then we have to go into the causes of the heart muscle being weak. So a weak heart doesn't pump as vigorously, doesn't function as efficiently, and so the patient loses a certain amount of functionality. So the functional status of the patient becomes reduced. When your heart is not as vigorous as it should be, you're not going to be as vigorous as you can be. And that state of the heart where it's not pumping as vigorously and as strongly to do its job, which is to deliver blood to the tissues of the body, is referred to as congestive heart failure. So if you have a massive viral infection of your heart, you have a parasitic infection like some parasites in South America and Africa that cause something called Chagas disease, for example, that can attack the heart muscle itself and destroy it. And so the heart will get weaker and weaker and not pump as efficiently. Also, patients who have those blockages in the coronary arteries. So the heart, which works so hard, 120,000 times a day, but it's not getting enough blood to its muscle because the passages to its muscle, the coronaries, are clogged. That heart will begin to become tired and begin to fail in the performance of its duties as a pump. That is congestive heart failure.
Chat Night Africa. Doc, usually when I go for annual physicals, they do a thorough check of my body system, my system. One of the things that the doctors pay attention to is cholesterol. Why is that crucial to heart health?
So cholesterol is very important to human health. The role cholesterol plays in heart actually is more related to the pathology, the problems that it can cause. So when I talk about your arteries in your heart, the coronary arteries becoming clogged, narrowed. So now if you have a channel and there's fluid flowing through it, if you narrow that channel, less amount of fluid, a volume of fluid will flow through it, right? That thing that causes narrowing of the coronary arteries and can lead to a heart attack is cholesterol, with a bunch of other agents, but principally cholesterol. So cholesterol can be good and it can be bad. It can be bad in that it can clog up arteries, not just in the heart, but also in arteries all over your body. When you have a stroke from maybe your carotid arteries that are narrowed, that's because there's a buildup of cholesterol in your carotid arteries. These are the arteries that supply blood to your brain. And if that buildup goes up to a critical level and there's minimal or diminished blood flow to your brain, or actually shuts off blood flow to a part of your brain, you may suffer a stroke. If that narrowing occurs in the lower extremity, an artery that goes to your leg, you may start to have cramps as you walk and your leg gets tired after walking a block and you have to stop and rest. That's called claudication. That is sort of like coronary disease, but occurring in the leg. So cholesterol can cause a buildup within the wall or the lining of a coronary artery, and it can lead to a heart attack if that buildup gets to a critical point. Now, so cholesterol is not bad. Without cholesterol, I wouldn't be here, and you wouldn't be there. And humans wouldn't be, there wouldn't be humans. So you need cholesterol because cholesterol is important in making many things, such as your hormones, your testosterone, the estrogen in women. For the body to make that, it starts off with a molecule of cholesterol.
How do you then, and I can
imagine. Give me a second here. Let me plug in the computer.
Okay.
Just 1 second.
That's fine, sir. This is Chat Night Africa. Yes, you can go ahead and do that, sir. This is Chat Night Africa. And we are with this Mount Everest, when it comes to cardiovascular complications. Dr. or Professor Nche Abegli-Zama is a professor of heart surgery at America's best university, Harvard. As you have heard, he travels worldwide to do free heart surgeries. That's amazing. He's talking to us about just what all these things mean, why you should have a healthy heart. Very important. Remember, one of my questions to him, my early questions to him was, is the heart? If I described the heart as the engine of the body, would that be an appropriate description? And he said to a certain extent, yes. I still have a lot of questions for Professor Nche Abegli-Zama. I told you he doesn't want to be called professor. He doesn't want to be called doctor. I've never seen a simple everyday Joe like this academic, this scholar from Harvard. Typically, when people leave those institutions with such accomplishments like yours, they think now they can talk down on other people, they can belittle other people, they can remind of other people where they attended school, where they teach, where they do this, what they have done. You are the exact opposite. Well, we'll come to how you grew up and what led you to where you currently are. Now, you talk about good cholesterol and bad cholesterol. How do I know that? How do I distinguish the difference between the two, good and bad cholesterol?
The public has been confused with that. So first of all, cholesterol is a specific molecule. Molecule is a unit. And so cholesterol is used by the body. It's actually, your body can make cholesterol. Well, there are two sources of cholesterol. So I had breakfast this morning, for example. If I had scrambled eggs, so the scrambled eggs have about 250 milligrams of cholesterol per egg. So I did eat an egg. That egg had cholesterol in it, and so it becomes absorbed in my gastrointestinal system into my bloodstream and is taken to my liver. So my liver uses that cholesterol to make hormones like my testosterone. I'm a man, and for our females, it's used to make progesterone or estrogen. So cholesterol is not bad. So without it, we wouldn't survive. Also, The body uses that cholesterol to build new cells. It's like the building blocks of a cell. You know, you and I are made up of trillions, 30-something trillion cells. And each one of those cells has part of its wall, the cell wall. One of the components used to build a cell wall is cholesterol. So cholesterol is a very essential molecule. Now, if I didn't eat enough cholesterol, my body will make cholesterol. So there's the extrinsic cholesterol, which you eat, which you take in food and drinks, and the intrinsic cholesterol that's made by the liver. And the body strikes a balance. So if there's less cholesterol coming in, the body makes a little bit more. So, but if there's an excessive amount of cholesterol coming in, for those of you who love to eat the huge slabs of steak, the greasy hamburgers, and the tons of fatty foods and whatever, fried foods, this, that, and the other, excess amount of cholesterol intake, the body decides to store it. And where am I going to store this? And one of the unfortunate things is that the body starts to line the major arteries of the blood, the coronary arteries of the heart included, with this cholesterol. And that's bad because we don't want those arteries to become blocked as it continues to line them. So that's what happens. So cholesterol itself can be good and bad. Now, what confuses the public is that people start talking about good cholesterol and bad cholesterol. Really, what they're talking about is a larger molecule called lipoprotein, which has as a component of it cholesterol. So it's not just cholesterol, it's got proteins and cholesterol and a whole mix. And there are different types of this muscle, this mass. Some of it is called HDL, which is high density lipoprotein. That's what a lot of people have heard referred to as the good cholesterol. It's really not just cholesterol, it's just a mass of which the major component is cholesterol. And then there's another component of this called LDL, low density lipoprotein. It just so happens that the low density lipoprotein has even more cholesterol in it. So if you have a higher level of LDL, low density lipoprotein, it predisposes you to cardiovascular disease, to these blockages. If you have a higher level of HDL, high density lipoprotein, it kind of protects you, because science and research has shown that what HDL possibly does is that it travels around your body, scoops up any excess cholesterol, takes it back to the liver where it becomes metabolized, that's broken down. So that's good. So if you have high HDL, it's good because that will help to keep your cholesterol level low by scooping it up around the body, so avoiding depositions, bringing it back to the liver where it's metabolized. But if you have high levels of bad cholesterol, which we call LDL, if you see that in your laboratory findings, that means that you have a greater chance of depositing cholesterol in the arteries of your body, which can lead to strokes and to heart attacks.
I am sure when listening to you now, many people are asking, when I go to the supermarket, when they go to the supermarket, should they buy this or that? Not. Why I'm asking you this question, sir, is you come from a village in Cameroon called Mankon, if I'm right.
Yes.
I'm your neighbor. I'm from Bali.
Yes.
In Bali, we enjoy fufu corn and jamanjama. You know what that means?
Right.
And my grandmother wouldn't eat jamanjama if she didn't have palm oil floating on it.
Right.
And in Mankon, you have this sumptuous achu, which is basically palm oil, bleached palm oil, and so on, other things added to it, alkaline stones, I think so.
Right.
They call it kangwa. Should people worry about eating achu? Or because lots of Africans who are, even in Indonesia is the biggest producer of palm oil.
Right.
If somebody's listening to you in Indonesia, what should you tell them about consuming palm oil?
First of all, a narrow focus on just oils and cholesterol is misleading, because oftentimes the causes of cardiovascular problems are multifactorial. That is, many causes that ultimately lead to a symptomatic problem. So just focusing on the oils and the cholesterol itself is wrong. There are many other factors. So getting back to that, it's true that you are what you eat. And I believe that African food per se, as you stated, it's excellent for you. So palm oil is not bad for you. Neither is achu or some of the vegetables and stuff. That's all really very healthy and good for you. And we need oils. We need cholesterol. We need carbohydrates. We need proteins. The problem we have is portion control, moderation. So if you have to have oil floating at the top of your meal, that's a problem. That's an excessive amount of oil. So that's what creates problems down the line. A moderate amount of oil that you use in cooking, it's okay. Now, remember too, that the problem we're now having with obesity is related to hypernutrition, and a problem with not just a diminished physical activity, it's also we're eating in excessive amounts, for example, the oils. And if you realize that a tablespoonful of oil has how many calories? 150 calories. Just a spoonful. And so what you eat in a portion of meal, just in oil, you've met your caloric requirement for the day, and you haven't even started to eat the meal itself. So these oily meals that we eat, they give you good taste, they make the food palatable, but if you eat way too much of it, it would be harmful. So in response to your question, palm oil is good. I do eat it myself occasionally, but if I do like in all oils, I have to do it in moderation, no more than a couple of tablespoonfuls.
Here is a question from my studio director, Beatrice Fomunen. She asked, Doctor, what do we do to reduce low-density cholesterol?
So I try not to focus as much on low density, but on the high density, because then you get confused about low density, high density. So low density cholesterol has a lot of cholesterol. You say, well, how did the cholesterol get that high? First of all, there are individuals who have a genetic predisposition for having a higher level of LDL, period. If you have that, then you're better off taking medication. There are drugs out there that can reduce the level of your cholesterol. And I'm not going to try to promote any, but if you talk to your physician, they'll pick one for you. And so you can take medicine for it. But if you want to, as far as lifestyle modification, what I personally do is regular physical activity. I run and hike a minimum of 4 times a week. And every day I do something physical, which means I walk, or I have a treadmill at home, and I try to avoid elevators, and it's just cumulative. So having a routine exercise and physical activity can help you reduce it. And another thing you can do is nutritional intake, and just be watchful about quantities of meat that you eat. Now, if somebody came over your house and you gave them a piece of steak about the size of your thumb, they may not come back. But what you actually did was you gave them what would meet their protein requirements for the day. Most of us only need about 60 grams of protein a day. That's the size of your thumb. So, but what do we consider a nice restaurant? One that feeds you a couple of pounds of steak. And each one of those steaks, meat is flesh, has tons of cholesterol in it. So if you're consuming a lot of things like eggs and a lot of things like steaks, a lot of oily foods, you're going to wind up with high cholesterol levels.
This is Chat Night Africa and the encyclopedia. The moving encyclopedia on the show today is Professor Nche Abegli Zama. You now see why Chat Night Africa is different. We bring people who bring information to weaponize you, just to make sure that you're not one of those statistics. People just drop off their feet, and very soon, before you know it, people around them are looking for space in the mortuary. Doctor said, somebody comes to your home and you give me a little piece of steak size of my thumb, they may never come back. You're so funny, Doc.
But that's all you need, actually.
You see, I'll be honest with you, I'm guilty as charged. You go to Bali meeting in Washington, D.C.,
yes,
there is a lot of meat there.
Yeah.
A lot of meat, a lot of food.
We actually consume, just give me a second here, because I got somebody at the door. Just
okay, sir.
Just 1 second.
Absolutely. This is Chat Night Africa. Please, what you can do something to save somebody's life. This is a broadcast. First of all, we'll not be able to have Dr. Professor Nche Abegli Zama here every day. So please share this broadcast. If you want it watched as in a WhatsApp box, please let me know. I'll send it to you as a WhatsApp information. That way you can actually send this. Somebody doesn't have to be on Facebook to watch this broadcast if you have it in your WhatsApp account. If you want that, please, by all means, let me know. I'll send it to you. Also, post any other questions that you have. I will press on Dr. Nche Abegli Zama to come into the green room even after the show to answer your question. Right. He is a very, very, very busy somebody. Yeah. As I told you, I've been running behind him to bring him on this program the last 12 months. Fortunately, at some point, I laid hands on him. I said, Doc, we've got to go. Africans want to hear from you. Humanity wants to hear from you. That's as simple as it gets. Here is what Dr. Kenneth Former says. I put his comment on the screen. He says, great guest, very enlightening guest, very enlightening. Thank you so much, Dr. Former. And there's a question here. I'll put that on the screen. Send to me on my WhatsApp account. Yes, you can watch this broadcast in your WhatsApp box. Somebody doesn't have to be on Facebook to watch this broadcast. So if you need it, just send a text message to me. Just also indicate, I will press on Dr. Zama to come into the green room to answer your questions. But again, please share this broadcast. This is a treasure trove of information called Chat Night Africa today. We did a series on marriage.
I'm actually on call tonight, so I had the phone away, so I had to run and get it.
I can understand, Doc. I can understand.
Yeah.
The other question, let's talk about treatment. Would you preach eating right if the doctrine that let your food be medicine still really makes sense? And in that case, what should people eat if let your food be your medicine?
So I encourage people, my patients and others, to practice balanced nutrition. So on a daily basis, vegetables, complex carbohydrates, avoid sugars, like simple sugars. And then protein, about 60 grams of protein. Like I said, about twice the size of your thumb is all the protein and meat and fish and veg that you need, and chicken. I personally don't eat meat, but I don't condemn it either. I eat mostly vegetables, grains, and fish occasionally. And then a minimal amount of fat, because you need fat, actually. It's part of a balanced diet. But as I stated, a couple of tablespoonfuls of oil a day is really all you need. Each tablespoonful, I don't care what kind of oil it is, it's 150 calories. So when you do this and you manage the portions that you eat, and so you reduce your caloric intake to less than 2,000 a day for a fairly physically active person, I think you'll be on the right road to maintaining a good healthy life. And you have to also, all that conjoined with regular or routine physical activity, exercise, program exercise. And even if you have some kind of physical deterrent, you may just choose to go walking. You don't have to run. You don't have to go out and join a gym. It costs an issue, a time factor. I mean, you can always find 30 minutes each day just for yourself. What I would do oftentimes is I'll walk 15 minutes in one direction and walk 15 minutes back. So eating a balanced diet of vegetables, complex carbohydrates, small amount of protein, fruits and nuts and vegetables will go a long way in providing you better cardiovascular health.
I can tell. Yes, go ahead, sir.
Yeah, and also some people have said alcohol is good or bad. Wine doesn't really have any important cardiovascular effects. I'm going to tell you that. People say it raises your good cholesterol. There are no studies. Now, there was a study that came out in the late 70s and the 80s that assumed propagated this whole notion about the good cholesterol level, HDL, being elevated in people who consume at least a glass or two of wine a day. That study was summarily dismissed several years ago when it was found that the fraction of cholesterol that is elevated when you drink wine is a non-essential fraction. So yeah, drink a glass of wine a day if you choose to, because it makes you feel good, but really don't drink it because you think it's going to accord you any nutritional benefit.
There is a question by Lucy David on the screen. Sir, of what great disadvantage is low blood pressure versus high blood pressure? I don't know if you want to answer that, sir.
I don't want to say low blood pressure because it's all relative. If your pressure is too low, then you'll feel dizzy, you'll feel tired, you'll feel exhausted. Your exercise tolerance would not be as good. If your pressure is too high, well, you may have a stroke, you may have a heart attack, you may develop kidney problems, and there's a lot of end organ disease that can occur. So what I would recommend is that to keep it somewhere where the national recommendations are, which is have it at least maybe 90 to 120, the top number, and the lower number in the 70s to 80 maximum, which is called the diastolic pressure. If you keep it in that range, I think your system, your cardiovascular system would function better. And remember, we didn't even talk about sodium intake.
I was going to ask you that question. Actually, Beatrice Fominian, my studio director, she has a question. What is the role of table salt in cardiovascular diseases? And is it good to completely avoid it in our foods?
Yes.
So when you talk about sodium, salt, yes, distinguish between what kind of salt are we talking about? The one we have in our foods on the table, dining table, or what is it?
So there's a lot of confusion when I talk about salt. My PhD actually is in chemistry, and oftentimes when I have people trying to give me lectures on what type of salt, or I've got this sea salt and I got this, at the end of the day, it's got the same chemical formula. It's NaCl, it's sodium chloride. That's your table salt. Now, there's some people who push potassium chloride. Stay away from that crap. Keep it simple. KISS. And so how much salt should you take in a day? I say you don't need to add salt to food. I do not add salt to my food. There's enough sodium chloride naturally in the vegetables that you eat, in the carbohydrates, and most of the stuff that you consume, natural stuff, has enough sodium chloride in it. Now, if you need to add a little salt for taste, well, by and large, do that. But excessive amount of salt intake can be deleterious to your cardiovascular health. It's been estimated that you can save 2 million lives in Africa if you significantly reduce the amount of salt that's consumed on a daily basis.
When you talk about salt, let's take those of us in the United States and perhaps Europe. Where do you find these salts? Where are they?
Of course, if you're the kind of guy who likes to go out there and eat potato chips, salt is hidden in many ways. What I do say is that I encourage people to start, when you embark on this journey for better health, you need to start reading labels. See, we have an advantage that many of our parents, my parents couldn't read or write, so they knew nothing about labels. They just did whatever they pleased, you know. If they feel there's not enough salt, well, they'll pour a gallon of salt in there, and that's good for them. But we have the benefit of knowledge. And I'd say read labels. You'll be surprised how much salt is hidden in them. If you like bread, you may see 2 different brands of wheat bread, but reading the labels, one of them may contain 300 milligrams of salt per serving. Another may contain just 75 or 120 milligrams of salt. Well, that's the one that I would buy. You're still getting wheat in both of them, same amount of complex carbohydrates and fat and this, that, and the other. So try to reduce it by being judicious in your choices, in the choices that you make, and avoid canned foods. Nobody should be eating, well, I say nobody, depending on your circumstance. If you're eating a lot of canned beans, a lot of canned spaghetti, all this stuff, a lot of salt is in them as part of the preservatives.
Wow. When you go to the grocery stores, Doc, you see all these oils, you see some cholesterol-free. Should we really trust the things, especially when you see on a cooking oil container, plastic container, free, cholesterol-free? Should we really trust that?
Yes. They've all been tested by FDA. But
okay.
It's a very important point is, you know, that if it's a plant or vegetable oil, it doesn't have cholesterol. Because plants do not have cholesterol as part of the cell wall. You understand? Plants don't make cholesterol. So there are a lot of fallacious ads out there, really to sell their products. They say, oh, it's pure vegetable oil, no cholesterol. Well, it's obvious because vegetables don't have cholesterol. So animal fat would have cholesterol, but vegetable fat does not have cholesterol. So peanut oil does not have cholesterol. Corn oil does not have cholesterol. Olive oil does not have cholesterol. And really, if you're looking at it and they say, well, it's good for you, always ask yourself, where's the evidence? Where's the data? You know? So I go for the caloric intake. I like peanut oil. Maybe a tablespoonful once every couple of weeks when I'm cooking with peanut oil. It has no cholesterol in it. But it's the quantity of oil that I use that matters. Because as I stated, keep that 150 calorie per tablespoon, you know, formula. And then it'll kind of keep things in perspective. So, yeah, if you use vegetable oil, then you're guaranteed there is no cholesterol.
A lot of people drink sodas, and sodas, sweet
sodas
drinks
are bad. Sodas are poison. If you drink a can of Coke, regular Coke, a day, you will gain 15 pounds in a year. If your activity level is not commensurate, that is, your expenditure of calories doesn't exceed your intake, you will gain about 15 pounds of weight a year from a can of Coke. Does that have any nutritional value? Absolutely zero. Since medical school, when I learned this stuff and I was doing cardiovascular research in the laboratory, I stopped drinking soda and I've not had a drop of it to this day. You don't need it. And what do I drink on a daily basis? I don't want to be a hypocrite. I drink water. I don't even drink orange juice. I eat oranges and I eat grapes. Why? Because an orange has half the calories and twice the fiber. So the logic is pretty obvious. And a glass of orange juice. Yeah.
Listen, there's legion of comments and questions. I have to apologize to everyone. We will not be able to take all your questions, but I can tell you one thing, Professor Zama, I'm begging him to, after the show, go back into the program, and if you can, please answer some of the questions.
Well, somebody's asking a question that I see here that may be life-threatening. It says, yes, can you say something about palpitations and heart issues? And real quick, if you're having palpitations, you need to see a doctor. Now, the most common palpitations that we have, we call them supraventricular tachycardias. They come from lack of sleep. So ask yourself, am I sleeping enough? Am I under a lot of stress? Am I drinking coffee? Am I drinking tea, excessive amounts every day? Am I drinking chocolate? These three things, coffee, tea, chocolates. Am I on a medication, for example, for cold medicine? Some of the over-the-counter medicine can really cause tachycardia. Tachycardia really is a fast heart rhythm that can sometimes be very bothersome or can develop into more serious rhythms. Another cause of tachycardia, abnormal heart rhythm or palpitations, is atrial fibrillation. That's very common. You see that a lot about that in commercials, touting all these treatments. And atrial fibrillation is one of the most common heart arrhythmias, rhythm problems that we have. And if you have atrial fibrillation, you need to get treated for it, because one of the most devastating consequences is stroke.
Doctor, let's talk a little bit about, there's a question here. Somebody's asking, why did you choose to do a PhD in chemistry?
So when I went after college, in America, you got to graduate from college, university with a bachelor's degree before you can apply to get into medical school. I really never intended to be a cardiovascular surgeon. I wanted to be a medical researcher. So I wanted to understand, drill down to the cellular, molecular level, why diseases happen. So my goal was actually to join maybe the NIH and be a research scientist. And so I went on and did a PhD in chemical physics with biochemistry concentration, and then MD medicine. And sometime, the importance of mentors. And I was doing research actually in cardiovascular disease. My PhD research, I came up with a way of actually inducing heart attacks and studying trace element metabolism, elements like zinc, copper, and magnesium complexes. But that research got so deep and involved, and some of my mentors got so interested, and one of those mentors happens to be a famous cardiac surgeon who began to encourage me to become a surgeon. And so I went on to train to be a surgeon after medical school. It takes 5 to 10 years. And then during that training, another cardiac surgeon on the faculty who took tremendous interest in me and my career encouraged me to do cardiac surgery. And that's how I wound up at Harvard to train in cardiovascular and thoracic surgery. So I found an opportunity where I can actually operate on the patient and apply the scientific knowledge that I had about the function of the human metabolism and physiology and bring all that to bear to give the best outcome for my patients.
One of the reasons you said people have strokes, develop heart disease, is because the coronary arteries tend to get clogged because of probably smoking,
Right.
the cholesterol. So the question is, and I think burning a hole in people's pockets now as we speak, is how do you flush? Are there ways you can flush your arteries?
Yes. So not flush them. So
like you flush the pipe in the pipes of your toilet at home.
Yeah. So it's not like what the plumber can do on roto-rooter. Well, we can roto-rooter. But what we have these ways. So now you have blockages in your coronaries, and they're significant. And you're having chest pain. You're having heartburn. You're having all these symptoms. You're tired. You can't walk a distance, and you get exhausted easily. You can't sleep flat. You have to sleep sitting up. All these, you have jaw pain, arm pain. So they do a cardiac catheterization, which is the ultimate diagnostic test. And they say, wow, you have blockages in 1, 2, 3 or more coronaries. How do we treat this? So the treatment in 2020 is you can treat it with minimally invasive procedures like stents. So you can pass a stent. It's like a scaffold up a large artery in your groin, directed under fluoroscopic guidance. That is a special X-ray you're looking, and you deploy it in the coronary artery, in the part of the coronary artery where the blockage is. And when you deploy the stent, it opens up the channel in that coronary artery and enhances increased blood flow down to your heart muscle. So you've addressed the problem. And remember, it's a supply and demand problem. Your heart doesn't want to stop. It's beating 120,000 times, but it's not getting as much blood. So the supply of blood is down, but the demands on the heart stay up. So you need to bring the supply up. It's the law of economics of the heart to make supply equal to demand. And so when you deploy the stent within the coronary arteries, you open up the coronary arteries at the location of the blockage, blood supply is increased down into the heart muscle, and the heart beats even better. So you've supplied blood to the heart. Now, if you have too many blockages or they're too complex, that's when a guy like me comes in. Now, who does the stents? It's a cardiologist who's specialized in doing that. They call them interventional cardiologists. When it becomes so severe, say all your 3 major coronaries are blocked, then you need coronary bypass surgery. Or you have an acute heart attack and your heart is failing and you're dying, you need a heart surgeon. You need somebody to split your chest open and stop your heart and then address it. And how do we do that? We do a procedure called, an operation called coronary bypass surgery. It's an operation that the first one was done actually in 1967, and hundreds of millions of them have been done, and probably over 500,000 of them are done each year in the United States.
This is what Dr. Ngong Blessing said in a text I just received. Divine Professor Nche Abeglis Zama is the brightest medical doctor I have come across. That's another doctor talking about you. That's Dr. Ngong Blessing.
He's too kind.
Yes. Anyway, here are 2 questions she sends to me. Why is why is heart attack said to be silent in women? When you answer that, I'm going to raise another question.
Mm-hmm. So silent heart attack means there are no symptoms. So why? So God has all these alarms within us because the heart is so crucial. This heart has to keep beating. It just can't stop. Because if it stops, you're cooked, you die. So because it's so critical, there has to be an alarm in there. And that alarm is what you get when you have chest pain, when the blockage is severe enough that the amount of blood being perfused, flowing down to the heart muscle is significantly diminished. You start to get chest pain, or you get jaw pain and arm pain. Now, there's some people who can have severe blockages and go on to 100% blockage and suffer a massive heart attack. What's a heart attack? It's when that blockage is 100% and there's no more blood flowing down the coronary artery. The part of the heart that depends on that specific coronary artery begins to die. And that constitutes a heart attack. So some people can suffer a heart attack without symptoms. So the question is, do women get silent heart attacks? Not any much more than men. The reason they may be described as having more silent heart attacks is because their presentation is not orthodox. It's not traditional, the usual, as I've stated earlier. They may not get chest pain, they may just feel tired, or they may feel actually that they're having gastrointestinal problems. And then another risk factor, people who have diabetes, severe diabetes, may not experience pain at all. Their first presentation could be heart failure. And it's not that you can say, oh, your heart is failing. No, they come in with swollen legs. They come in very short of breath. They can only sleep if they have about 3 pillows, or they sleep on the couch, on the lounge chair. They can't walk a few yards. They have to stop and rest. And then they do some testing and they go, oh, you have heart failure, but I never felt any symptoms. You've got diabetes. So diabetes can diminish the sensations that would lead to a diagnosis of a heart attack.
If you indulge in sexual activity, you may want to pay attention to the question I'm going to ask, but not before this one. Another question from Dr. Blessing Ngong is, why does heart attack risk increase in women after menopause?
So, an excellent question. So, years ago, it was actually thought, and I remember when I was a student at Cleveland Clinic, I remember attending one of the lectures by the first guy who did the first coronary bypass surgery, Dr. Rene Favaloro. He'd come back from Argentina to visit, and I was doing research then in the laboratory. And I attended the lecture, and they talked about, well, in a heart attack, it's really a man's disease. and not too many women get it. But then, as more data accumulated, we began to realize that up to about age 50 or prior to menopause, we don't see a lot of women with heart disease or heart attack or coronary artery disease, to be specific. But after menopause, the incidence among women skyrockets. And the question was why? Right now, we seem to think that is because there's a protective element involving having estrogen. So women have estrogen. So they have a hormonal protection prior to menopause. And after menopause, when the levels of estrogen in a woman's body plummet, that protective function of estrogen is eliminated to a large extent, and their proclivity, it predisposes them to cardiovascular disease. So they're protected before menopause because they have estrogen, and after menopause, when the estrogen levels are low, they lose that protection and they become more vulnerable physiologically.
You are watching Chat Night Africa. I'm Divine Chamukong, and my guest today is Professor Nche Abegli Zama. The question every man is asking: sex, heart attack, heart failure, cardiac arrest. Something men ought to or should worry about? Now, I ask you this question because some time ago in Cameroon, a senior divisional officer collapsed while having sex with a younger person, in a hotel. And there've been stories that men during sexual activity sometimes collapse and die. Is the collapsing related to the sexual activity? If yes, how?
So if you had coronary artery disease, you had blockages in your coronary, and there's not enough blood flowing down to your heart muscle. So there's coronary insufficiency. The supply of blood doesn't equal the demands on the heart. So if you're sitting and watching television or relaxing and you're not physically active, you're fine. What happens when you involve yourself in a vigorous activity such as sex? Your heart is beating harder, right? And what happens is that the flow of blood has to increase to match. Sometimes you can increase the flow of blood through your coronary artery, and research has shown about 6 times its resting stage. So they're very compliant vessels. But if you have a fixed blockage, intuitively you can imagine that the supply does not change, but the demands go up. That's a formula for disaster, because the heart can get overworked and you can run into problems. And so that's what happens if you have pre-existing problems. And so it may not be because she's young, that becomes sort of that's all superstition, but it's because, you have pre-existing cardiovascular problems that you probably didn't know about. Also, if you have aortic aneurysms, for example, and you become the physical demands of sex, the vigor, this, that, and the other, can increase your blood pressure, can cause a rise in your blood pressure, and a high blood pressure in the setting of a large aortic aneurysm is a formula for disaster, because that can lead to acute rupture, and you can die from a ruptured aorta because of hypertension, high blood pressure. So, or if you had pre-existing heart valve problems, for example, and didn't know you had a leaky heart valve, then you become vigorously active, you can actually disrupt your valve, rupture a part of it, or develop acute heart failure because the stress that you induce to your heart as a result of your physical activity. And this can lead to heart failure and actually possibly lead to your demise. So there's a whole myriad of issues that can happen with your heart to explain why somebody in a hotel room or wherever engaged in physical activity may suffer a myocardial event.
Well, gentlemen, don't try to be a Rambo to impress that lady. You don't. Now, Doctor, the question, we're going to have to wrap up in a couple of minutes, maybe 15. Sure. I promised everybody that I'll have to ask you this question. how did you get to where you are? I personally heard about your story in Sacred Heart, correct? You attended Sacred Heart in Bamenda.
Yes.
And if you want to tell us a bit of that story, fine. You were not somebody who was born with a golden spoon, like they say, in your mouth. So how did you get here?
So yes, I came from a very poor family. Actually, my parents were illiterate, but my mother, she always had this thing. I was a very restless kid, so I was sent to school about age 3, and they'd actually taken me on a trip around town. I'm writing a book now, and this will be in it, to look for a school that would admit me, because wherever I went, they said he's too young, and so they had a brand new school somewhere, in a Baptist school. And I was taken there, and my uncle, in those days, he says, well, he's old enough. You know, they had you touch your contralateral ear, and he would disarticulate my arm just so I could touch it. Anyway, I got admitted, and I just fell in love with learning. And I wound up skipping a couple of grades. And, but my mother, actually, my parents were very attentive. And I remember my mother pointing to some missionary who happened to be coming by the village. He goes, I want you to know as much as him. And I really didn't understand what that meant. And she would light a candle, and she would sit there by me to do homework, to read. And there was nobody around in the village who could help me with my homework, so I struggled. And she would sit there, and she was very attentive. She was very concerned. And I've always thought that was so important because she saw me before I knew where I could be, She saw that future. And unfortunately, she died, as some of you know, at a very young age, probably about 29 or so, 30. But she instilled something within me before then. And I was a top student in elementary school, but then I flunked something called the Common Entrance, and which I've always said is a horrible educational system, because your future success can be predicated on one lousy exam, and all the preceding years, your performance means nothing. And so I didn't go where I'd always wanted to go, with Sacred Heart. So I wound up in those days, some of the local technical schools weren't as glamorous and they weren't as challenging. But from what I hear now, they're at equal footing, like Sacred Heart. Anyway, I go there, and a few weeks later, I quit because I'm not happy. This is not me. I had a cousin who was at Sacred Heart, and older, who was studying biology, physics, chemistry, all this esoteric stuff that he would tell me. And I liked that stuff, and I often would read his books. And so after a few weeks, I spoke to an uncle of mine and expressed an interest. And he says, listen, come with me. So he took me on his bicycle, and we went to Sacred Heart. And there was Brother Vincent or something, and the missionary. And he says, no, we don't have any space. So the very next day, my uncle, and I call it importunity, he wasn't giving up. He took us back. And this guy, he looked at me, and my uncle said, listen, his mom has died. He's very smart, He says, but he didn't pass the common entrance. He says, don't worry. He says, I have no room in the first year. He says, well, I only have room in the second year. And my uncle says, we'll take it. He says, what, you haven't studied physics, chemistry, math, all this stuff for an entire year, He says, he'll take it. He says, well, I'm going to admit you. He says, if you score, there were like 50 kids to a class, and I had to be among the first 25 or I'll be dismissed. And so I started Sacred Heart, totally disadvantaged. And I remember the first quiz. I'll make it real quick here. And it was a chemistry quiz, and the teacher stood there, and he was reading out the names of the chemicals, and you're supposed to write the formulas. He said carbon dioxide. So I wrote it down phonetically, Ka, whatever way I could spell carbon. And the very next day, the results came out, and he was concerned. He says, how'd you get here? You're not going to make it. So I immediately started to study not just the second year stuff, but the first year. And by the third year, I'd caught up. And because I'd faced such a challenging situation, I didn't get involved in any extracurricular activities. And until now, I don't play any sports. And so all I did was study. And by the fourth year, I was first in my class, and I graduated with decent results and stuff. And so I spent just 4 years in secondary school. And that same uncle, he's of late, and He was just a great mentor. He was my mother's uncle, actually. He used to tell me, he says, someday you're going to go to Oxford. And that's all he knew, you know, from colonial days and stuff. And long story short, I started applying to American schools. I wanted to go to university. I didn't know how I would get there. But, you know, it's just one of those things. If you set your mind to something, if you've got a goal in mind and your life is purpose-driven, the means to get there sort of just appear. And eventually, I was able to get a visa to the US without a financial statement, because my scores in the GCE had passed every subject I'd taken with outstanding grades. And I believe that's what convinced the American consular officer to give me a visa. And so I wound up in New York with $20 and a one-way ticket. But that didn't stop. The challenges kept mounting, as you can imagine. You live here. And but there were many false starts. But I always say, wherever you are in this world, somebody helped you to get there. There's a gentleman who found me in the YMCA in Baltimore, a teenage kid. I was so young, and who was homeless, and who took me in. And I stayed with him for a year and then moved on to Boston, because a lot of people recognized something within me that I didn't. And I got enrolled in college, and then the rest is history. So it's about, when I tell a lot of kids, it's about importunity. Have a goal in mind, and then start mapping strategies to get there, and keep your eye on the goal, and you will get there. You know, it doesn't matter. And also, always remember that wherever you are, somebody helps you to get there. You know, and when time comes, you need to give it back.
Doctor, when somebody sees you, professor at Harvard University, or the accomplishments, if you didn't tell your story, nobody would believe that you ever failed at any point in your life. What did those failures teach you, and what would you relate, or what is the advice, the lessons you draw that you like to share with the people who want to be like you?
Yeah. So the reason that I always realized earlier on when I failed, I was to blame and nobody else. I realized that I did just enough to get by. And so it's a very important question, because I learned later on to overachieve, and especially in America, because you have to deal with, you know, really competitive atmosphere from just extremely bright people in some of the schools that I went to and stuff. Not only that, I had the extra baggage of being a Black man. And when I became aware of the effects that could have and the consequences, I learned not to leave any stone unturned. And so I always had to go further than the assignment. And really it became a habit, you know, outperform myself, take myself to the maximum in whatever I did. Because, I mean, it just wasn't going to roll in success on the wheels of inevitability, and nothing would be handed to me on a silver platter. The people who were always looking for the opportunity to present that constraint, or to prevent me from getting to where I needed to be. So in order to overcome that, to offload that, what I did was I would outperform. So what am I saying? If the lecture was on the gastrointestinal system, and just to know the organs, esophagus, stomach, small intestine, large intestine, rectum, I would go beyond that. I would read the in-depth anatomy, and I'm not going to get into the big word, the histology of how things function. So my responses went beyond the acceptable responses.
Note taken. My director is saying we have to wrap up very soon. But here's the last question by Dr. Brownhilda Santo. Great show and great teaching. Question: is heart attack more frequent in the morning? If so, why? Why does cold temperature increase I think chances of heart attack? I give you 2 minutes to do that because we have to wrap up, sir.
So heart attacks can occur any time of the day, and a cold temperature can lead to heart attacks because it stresses your heart. Because when it's very cold outside, your heart has to beat harder, to be able to warm up your body, to supply blood to the cells of your body. Your oxygen demand actually goes up. But if you have narrowing of your coronaries that you didn't know about, and now your heart is being asked to work extra hard, a heart attack can develop.
Thank you, Professor Nche Begley Zama. As I told people from the start, he did not want me to call him professor or doctor. This guy is just amazing, one amazing human being. You meet him the first time you talk to him, you love him. He's just so simple, infectiously humble. We're grateful to you, sir. There are just so many things you could have been doing this evening, either at Harvard, at Penn State, or wherever you work. Just so many things, or overseas doing free heart surgeries. But you decided to come here to Chat Night Africa. We really appreciate you, sir. We hope you will take another 1 year to bring you back here.
I am, because you are.
Thank you, sir.
Okay, sure.
And that has been Professor Nche Begley Zama.
Thank you.
That has been Chat Night Africa. Chat Night Africa from Washington, D.C. metropolitan area. Dr. Zama has to run. Maybe he has to cut open the chest of somebody. Please share this video. If you want it on WhatsApp, let me know. That way you can send to your friends who are not on Facebook. You don't have to be on Facebook to watch this broadcast. There has been Chat Night Africa. Chat Night Africa from Washington, D.C. metropolitan area. Production supervisor, Dr. B. Tatzong Famundam. We have technical director, Mumba Lingua. And we have Nse Rogers Fool, our head of editing department in Lagos, Nigeria. Chat Night Africa, studio director, Beatrice Fomunen. Production assistant, Emmanuel Wayindi, John Santo, Lord Benson at Foncha Street, Bamenda. Special assistant at Chat Night Africa, Daniel Eno, and Justin Nchamukong in Yaoundé. If you want this broadcast on WhatsApp, please shoot me a text. Shoot me a text. If you want this broadcast on WhatsApp, Chat Night Africa is compiled and presented by Divine Nchamukong. The power of Chat Night Africa. Thank you. Merci à tout le monde. Merci à tout le monde. Attention. Thank you to everybody who should have watching this broadcast. Attention. Again, I will be back. We have our page, broadcast page, Chat Night Africa Live. Go to Facebook, search Chat Night Africa Live. We have powerful broadcasts on that page. Like that page. That way, once we come on, you are alerted. Chat Night Africa, not for Africans only. Chat Night Africa, where the world meets Africa. Chat Night Africa, Africa in miniature. And for those of you who are having troubles in marriages, don't have a heart attack, don't have a cardiac arrest, go to Chat Night Africa broadcast page and watch 3 powerful broadcasts on how you can be happy in your marriages. Don't assume that you know it. Lots of things you don't know. You won't know this until you watch that broadcast. Let's get to the moment. Thank you to everybody. Goodbye. I'll see you again for yet another edition of Chat Night Africa. We're gonna dance.